Hi everyone, my name is Jada Duckett, and today I will be talking about antidepressants, the prescription drug. So the official name is in fact antidepressants, and antidepressants are a depressant medication prescribed by health professionals to treat various different mental health conditions such as depression, anxiety, bipolar disorder, chronic pain, PTSD, and many more. A few street names include the happy pill, that's what some people like to call it because it boosts your mood. And they are not scheduled under the Controlled Substance Act since there's a low abuse potential with these types of drugs. So there are many different classes of antidepressants, and each one affects your neurotransmitters a different way. These include SSRIs, SNRs, MAOIs, and tricyclides. So what does it do to the brain? Antidepressants balance your neurotransmitters like serotonin, norepinephrine, and dopamine to regulate your mood, behavior, and your mental well-being. Through a process called neuroplasticity, these drugs can also help your brain form new connections between nerves, which can in turn improve how parts of your brain interact. This overall process leads to improved moods. So, a little bit of background. The first antidepressant was actually discovered in the 1950s completely by accident. So, originally, people were trying to develop a treatment to tuberculosis. However, they found that the chemicals MAIOS and TCAs were found to improve mood instead. So, the development of SSRIs was discovered in the late 1980s, which revolutionized the antidepressant drug as there was an increase of safety compared to the ones in the 1950s. So for method of use, antidepressants are typically taken orally with the pill that you swallow with water. Daily use is required for effectiveness. Antidepressants don't work instantly. As it's stated, it may take up to 1 to 2 weeks before noticeable side effects. It is illegal to share or sell any type of antidepressants, and it is legal only by prescription. How much does depression truly cost? The price of medication has many factors, including the type, generic or name brand, the dosage, and the insurance. So, for example, in a generic brand like fluoxetine costs $4 for a 30-day supply, while a name brand like Prozac, which is very common, costs upwards of $490 for a full 30-day supplies without insurance. So tolerance. So unlike typical addictive drugs, there isn't really a tolerance you can build to these type of drugs. However, they may lose their effectiveness over time. Now, for withdrawal, there is a thing called antidepressant discontinuation syndrome, which develops in about 20% of patients when there is an abrupt stop of using the drug. Symptoms include flu-like, fatigue, headache, achiness, sweating, insomnia, nausea, dizziness, vertigo, lightheadedness, anxiety, and aggression. Taking too much of this drug can be life-threatening, so make sure you always follow the provider's direct instructions. So now for the trends. According to the National Center for Health Statistics, the CDC, 13.2% of adults over the age of 18 use some type of antidepressant in the past 30 days. The use of these drugs are also higher among women at 17.7% compared to men at 8.4%. There is an increased trend in age, as the use was the highest among women over the age of 60 at 24.3%. There was a higher use among white individuals at 16.6% compared with Black 7.8%, Hispanic 6.5%, and Asian with 2.8%. According to the World Mental Health Survey, 3.1% of the world's overall population used some type of antidepressants within the last 12 months. So some interesting facts is taking antidepressants are a lot more common than you think. In fact, 1 in 10 Americans take some form of it. And also combined with therapy, there is a very high success rate with using these type of drugs. The most commonly prescribed antidepressants is SSRIs. Fluoxetine, which is also known as Prozac, is the most well-known drug. And one thing I want you guys to always remember is to always follow medical advice for any type of drug or anything that you are taking. And to learn more, there's a YouTube video titled Tablets for Depression, Do Antidepressants Help? And it's a really good documentary, as well as the Mayo Clinic Antidepressant Selecting One That's Right for You to get, so it can help you dictate whether you want, if this drug is right for you. Thank you so much.